So I had this patient, right? Yeah, another one. Anyways, she was lifting something up. She was lifting a big old sack of potatoes, I guess. And it just so happened to be that she was bent a little more to the right. This is a lateral view. But if you look at it, in the posterior view, you have a bend to one side, and that means we are loading into the lumbar spine on the right side. That means through the lumbar spine into the sacrum is more loaded on the right side, pushing it down more so on that right. It wasn't the best technique, but that's what happened to happen. So by comparison, it's as if the leg and innominate on that side was being driven up, and it creates what you might call an upslip. One going down, one going up. That's just how it works. It's not good, but that's what happened. And so when you get this upslip, there are problems that go along with. Understand that between the innominate and the sacrum, there are ligaments. And there are ligaments between both sides, of course, but if you move one side up, get rid of those guys. If you move one side up, you start to strain those ligaments. You start to make all kinds of painful stuff happen from there. It starts shooting off at you. Not happy. Not happy at all. Anyways, these ligaments, whether we're looking at the front or the back, or any direction really, front or the back, they will cause irritation into the system. They will be very unhappy. And this will come back in the form of nervous feedback, one side or the other. Anyways, it's going to then come back as muscular reactions in this area. And it just so happens those muscles go really far up. They go really, really far up. In fact, all the way into the neck. And you'll find that those erector spinae muscles specifically can start to pull on that neck. And that's actually what the patient came in for. She had no awareness of the fact that there was an upslip. Why would she? Frankly, why would anyone? But the neck was in pain, and that had to be dealt with. And it could be neurological, it could be mechanical, it could be the fascia pulling on the neck and the nerve creating that fascial pull, but it hurt. And, we should probably do something about that. So we've got to figure out a way, really, to free up this innominate that's stuck in the direction that it's stuck. So, knowing what we know, knowing that the innominate has basically become stuck in this position, well, we have to ask, well, what held it there, Because there's more to it than that. So, what can hold it in that position is the things that are above it. If it's up, it's being held up. Pretty simple, actually. So, QL, very good. Hey, look at that. Bunch of bands. They are generally up. That's not bad. On top of that, I'm just going to draw the other side for clarity's sake. We've got those erector spinae. I'm going to pick the iliocostalis muscle, just because it seems to be in the proper orientation. But understand, of course, there is a unified fascia in that area. So in a way, longissimus, semispinalis, spinalis they could all potentially pull on it. But we've got more than that in the options, of course. So, for instance, the rectus abdominis, which we've thrown a xiphoid there for it, rectus abdominis can pull in this direction. And then we technically even have the oblique muscles capable of pulling up and up and up, all the way, maintaining that innominate, that big old hip bone, which is not really hip bone, because there is no hip bone. There's a hip joint, but there's no hip bone, maintaining that proper innominate in that up position. So the first and most important thing is that we actually have to find a way to negate the contractions of all these muscles. We have to get rid of them. We have to get rid of whatever's holding them there. And if it's short term, usually it's more of a nervous thing. It's more of a nerve irritation. And hopefully we can get rid of that pretty quickly. But if it's more long term, it's a bit of a fibrous situation. And it's very, very stuck, and we need to go in there, and we need to figure it out, and we need to loosen the things up. But once we've done that, it's actually a pretty simple matter. We need to hold the sacrum in place, and we need to find a way to get that innominate to gradually and slowly and safely move down. And then we're good. Hey-o.